Hi, my name is Lisa Tuccio. I'm the nurse practitioner that works here with Dr. Alan Spiegel. And I want to talk about a procedure in our office that we're doing here to help our peripheral neuropathy patients. But first of all, I want to talk about what is peripheral neuropathy. Peripheral neuropathy is a disease that affects the nerves that are furthest away from the brain and the spinal cord. So that would be the arms, the fingers, the hands, the legs, and the feet. Peripheral neuropathy is a degenerative disease, which means it progresses over time. So our patients in our office are dealing with a myriad of symptoms when they have peripheral neuropathy. A lot of them report to us that they're complaining of burning pain that wakes them up in the middle of the night. They have numbness and tingling. They have a decrease in sensitivity to temperature change. They have poor positional sense, which means they can't feel the ground, and it causes a lot of imbalance and poor coordination. So many of these symptoms really interfere with a patient's quality of life. They can't sleep as well because of the pain. They also are fearful and engaging in activities that they used to once love, like for instance, chasing after their grandkids, or possibly playing golf, or simply just taking a walk. So up until recently, the only thing we can offer our patients with peripheral neuropathy is medication. And all medication does is just mask symptoms, and they come with a lot of side effects. A lot of them are complaining that they're very drowsy during the day. It causes a lot of dizziness, it causes tremor, dry mouth, and constipation. And these are very unfavorable side effects. So 2 years ago, we introduced in our office something called PRP. And PRP stands for platelet-rich plasma. And that was a game changer. And the reason why is because platelet-rich plasma is part of regenerative medicine. And regenerative medicine means that your body can treat itself. So that is what we're using to help our patients. We are using the patient's own blood products in the form of plasma to help not only regenerate the nerves, but the supporting tissue that surrounds the nerves. So most of our patients that have been injected already are reporting anywhere from 20 to 90% improvement. So how is PRP prepared? Well, we start by taking about 1 to 3 vials of blood from the patient. We then go ahead and we put it in their centrifuge, and we spin the blood to separate the blood from the red blood cells and the concentrated platelets. We then take the platelets and the plasma, and we inject it in strategic areas in the patient's lower extremities to bathe the 3 major nerves that cause sensation to the lower legs. Patients are walking out of our office 5 to 10 minutes after the procedure. It's minimally invasive, and there's minimal risk to the patient because the patient will not reject their own blood product. So PRP has so many benefits because it utilizes the patient's own plasma to stimulate its own growth factors and its own innate stem cells to really promote healing within the surrounding damaged tissue. Please let us know if you're interested in setting up a consultation to learn more about the procedure. We'd be happy to answer any of your questions. We are offering this to our patients with peripheral neuropathy because we don't want to just mask symptoms with medications. We want to truly promote healing from within.